Kia ora koutou katoa. Welcome once again to the Ministry of Health, and thank you for your support in including our sign language interpreter in the frame. Can I just begin with the important point that we have no cases of confirmed coronavirus nor any suspected cases of coronavirus COVID-19 in New Zealand. Over 60 people have been tested and those have all come back negative. There's been quite a lot of interest in what's happening at the border here in New Zealand, and I thought I'd just have a quick run through for people's information because there are still a lot of people coming through the border from a range of countries and also several hundred from China or who have travelled through China. So let me just describe what happens at the border. So people travelling from or through mainland China, anywhere in mainland China, are actually being screened prior to boarding a flight to New Zealand. And anyone who is not a New Zealand citizen or permanent resident or from one of the realm countries is actually not allowed to board the flight. In the early days of the border restrictions, the early day or two, there were a small number of people who arrived and then were stopped at the border and went back to where they had boarded. We've had public health officials at Christchurch and Auckland International Airports since the 27th of January, and there are also public health staff at Wellington Airport, which receives a small number of international flights. We're constantly monitoring what we're doing at the airport and how our checks and controls there are in line with what other countries are doing, particularly Australia, but also others, and also repeatedly looking at the WHO advice on this. So just to reassure people about what that procedure is when people arrive. So as passengers, all passengers come off flights arriving, for example, at Auckland International Airport. They move through the airport and they arrive at the customs lines. If they have a passport they can use at the e-gate, then they go into the e-gate line, and when they get there, they get asked the question when they scan their passport that says, have you been to or through mainland China in the last 14 days? Now, this is a statutory declaration. If people say yes, they have, then they are required to go. They are pointed in the direction of the customs officials and they join a line with others who are not able to use the e-gate. The customs officials check their passports for stamps that would indicate they have been in China and when. And if they have been in China since the 3rd of February or anywhere in the Hubei province in the last 14 days, then they are directed to public health staff who are right there, who check them, in other words, have a chat to them, provide them with information about self-isolation, reiterate the expectation that they will self-isolate for 14 days, and that information also includes the phone number for them to call to self-register. So everybody who has been in or through China is receiving that information. If someone is unwell, there is a nurse there to check them, including take their temperature if it's necessary. So there is a very well-developed process now at the border, and one of the things we'd like to do is we're going to do a walk through that and video that in the next day or two, and we'll provide the footage of that so you can use that stories that you may want to run. So we'll be doing that through the Auckland Airport and making that video available. There are also electronic signs right through that journey and some banners, and here I've got one right behind me here. You can see it's very clear. So these are very clear also in the airport at a number of points. So we are taking the border responsibilities very seriously. Another issue people are interested in, and that also relates to the border, is around cruise ships and maritime traffic. I spoke to this briefly yesterday and I talked about this process of pratique where a ship coming in, whether it's a merchant ship or a passenger ship, has to actually be cleared. So the ship's master or doctor has to radio ahead and declare if there is anyone on board with a notifiable infectious disease. And you'll be aware that COVID-19, novel coronavirus, is a notifiable disease in New Zealand. So we have a good process in place. I should also point out that that pratique process is something that airline flights do as well. So pilots have to radio ahead if they have anyone unwell on board, and there's a very well-established process for those flights being met by health staff at the airport and people being dealt with appropriately. So I guess in summary, this is a rapidly evolving situation. If I reflect back 3 weeks, and I was going back through some of the situation reports, 3 weeks ago there had been less than 300 cases of this disease. They were all largely in Hubei province. There had been 6 deaths reported. So here we find ourselves 3 weeks later with a much different picture, and our response over that period has been very systematic, very well planned, and we continue to evolve it and adapt it as the situation evolves. And one of the things I would like to do is extend an invitation to you after this, if you would like to come down and look at our National Health Coordination Centre in the basement and just get a feel for the intensity of effort and work that's going in there that is leading the cross-government effort to respond to this still emerging, still evolving situation. So thank you very much, and I'm open to questions.
You've mentioned cruise ships and people coming in on cruise ships. Are there any cruise ships under suspicion at the moment?
There are no cruise ships under suspicion. We have had a cruise ship. I think there's a cruise ship heading towards Tauranga, and the Fiji authorities have been in touch. There was someone who was unwell on that ship, but there's no suggestion that there's coronavirus on that ship. And of course, as you can imagine, especially with the situation of the cruise ship that's effectively in quarantine in Yokohama, Japan, there is a high level of awareness around cruise ships. And as I described earlier, either the ship's doctor or the master of the ship has to radio ahead to the port if there is anyone unwell or suspected to have a notifiable disease.
Are we taking any extra safety measures with that cruise ship that arrives tomorrow, the Voyager, given that one of the passengers died of flu-like symptoms?
Well, we will be expecting that the ship's doctor or master will report in and give a full report. And again, quite a routine procedure. If necessary, local public health staff will go out and meet with the ship's doctor and assess the situation.
Do you think that's enough given the symptoms were similar to that of coronavirus that this person had?
Of course, in all these situations, we have to rely on the professionals who are looking after individuals. It's the Northern Hemisphere flu season. We know that the symptoms of COVID-19 are very similar to those of influenza and indeed other respiratory illnesses. As I say, just to go back to my point, given this situation, there is a high level of awareness for anything that might be novel coronavirus. But of course, it's not possible for someone to have coronavirus if they haven't got any history of having been exposed to it. It's far more likely they've had influenza.
And sorry, just with that influenza, how are we able to know that it's influenza given that the symptoms are quite similar with coronavirus?
Well, again, we rely on the clinical picture, the history. These are routine in assessing any person for any illness, and there would be a low bar for getting testing done if there was any suggestion that the person had been exposed to coronavirus. There was a question behind that.
Yeah, I just wanted to ask you about the Diamond Princess in Yokohama. Are there plans in place for those people coming home? Are they going to have to go into quarantine again once they're back in New Zealand?
So my understanding is that the Japanese officials are requiring everyone to stay on board that ship for the full 14 days. There is clearly a large number of infections that are confirmed of people there. We will be relying on the Japanese authorities around the time of release that they think the risk is low, and our foreign affairs folk will be working with New Zealanders on that ship to support them if they require it to get back home.
And of the 4,000 people yesterday that haven't registered but have returned to New Zealand, how many of those have you managed to get in touch with so far?
So as of midnight last night, around 2,500 people had self-registered, and I know that Healthline is working through the balance of people who have come into the country and haven't yet or haven't had the opportunity to self-register. So they're working through that as fast as possible.
Have they come across any that are not self-isolating, and what do you do when you come across them?
Look, when I spoke with Andrew Slater, and actually he did an interview this morning, so that's the chief executive of Healthline, he said that no, his staff hadn't reported that people weren't self-isolating. And again, just to reiterate, because this came up at the discussion yesterday, this is a high trust arrangement, and that is typical of any of these situations. It's a unique situation. I can't recall a point in time, even in 2009, for example, when we had the swine flu pandemic, that we were asking people to self-isolate for 14 days. But the sense is, we've had over 2,500 people that have self-registered, they are self-isolating, and I think there's a really, really strong sense of common purpose around keeping the community safe here. So I think that's an impressive response.
Right. at least how many more to track down?
So, well, the balance, and it will be several thousand, and they'll be working through those.
Just to be clear, has a vessel been detained or decontaminated?
Not that I'm aware of at all, no.
Just looking at measles and that spreading over to Samoa, are we doing enough in this situation to protect our Pacific neighbours?
It's a very top of mind issue for us, and it's one of the key inputs into the decision around the current border measures here. And we're also in close discussion with our Pacific neighbours. Many of them have implemented their own border restrictions, as you well know, and some well ahead of us, Samoa in particular, clearly very concerned given their experience with measles last year. So the fact that New Zealand is a jump-off point for many of the Pacific Islands is a strong motivator of what we're doing. And likewise, you'll recall that most of the people who are non-New Zealanders, the 59 people who are up in Whangaparaoa, are from the Pacific Islands, and so we're supporting those countries to keep those people here in isolation before they go home.
Is it necessary to stop kids going to school that have not been in mainland China but travelled in other areas overseas?
No.
Just on the two New Zealanders who have been diagnosed with coronavirus who were on the Diamond Princess ship, what information is the ministry actually getting from the Japanese Ministry of Health on how those people are doing and how they're coping in hospital? I mean, have you even received information on what their condition is at the moment, or whether they're improving, getting worse? I mean, what kind of communication is happening there, you know?
So the lead agency for that is Foreign Affairs and Trade, in fact, and I know their consular folk there are in close contact with those who are in hospital, the two New Zealanders, and they're the ones who are monitoring their condition and providing support as required. We don't receive information directly about that. That's an MFAT responsibility.
Does the Ministry of Health have the power to do anything about people who won't self-isolate, like employers or people in general?
Well, this is a whole of society effort, and I think that's what we've seen, as I say, is a really significant response from people. I think people understand the rationale. I think employers understand the need for us to do this. And what we are trying to avoid here is a sustained community outbreak of COVID-19 in a rapidly evolving situation. As I said yesterday, medical officers of health have powers to require people to isolate or be quarantined. It's very unusual to have to use those.
And yesterday you talked about the World Health Organization asking countries to be aggressive in their response to this. Would you call New Zealand's response aggressive?
Oh, look, I think it's purposeful. It's precautionary. The fact that we have these travel restrictions on at the border, again, first time I can recall those being implemented, and this requirement and expectations on Kiwis returning from China to self-isolate is a very significant response. I think it's proportionate and it's part of our well-planned response. We continue to evolve it as the evidence emerges.
Is the ministry looking at extending the travel restrictions to other countries, like that's the point?
Yeah, not at this point in time because the number of cases in other countries is still very small, but again, that's evidence that we continue to watch. And of course, there are countries that have less well-developed healthcare systems where they may have a small number of cases, but their ability to respond and contain local outbreak might be less than, for example, in countries with well-developed health systems. We're watching them all quite closely.
Are you going to keep Whangaparaoa as like a long-term isolation zone?
It's not the plan at the moment, but we're keeping all options open. Perhaps one more question, if there's anything else. If not, can I just reiterate that invitation?
Yeah, so just the logistics around that, I think what would be best is if my colleague Alan will be here, so you can leave any of your stuff here and just carry your handheld cameras down. I'll just go ahead and let them know that we're just about ready.
Sure.
And Paul will take them downstairs, actually.
Great. So look, thanks very much once again for your interest and your support on this, and I hope you enjoy the visit down to the National Health Coordination Centre. Kia ora tātou.
So if you just wait here, get your gear ready, and Paul will bring you down in about a minute.